I had a patient experience about 5 years ago. He found me the way you want to be found. He did a search on Google. He looked at the cases on our website. He went to social media. He liked some of the dentistry we're doing. He came in for a consult. And I asked him how he found us, and exactly that's how he found us. And his situation was that he had 4 veneers on his front teeth. And he was overclosed and he had worn the daylights out of his lower anterior teeth. And he goes, I've had these done 3 times. I've had them done 3 times and they keep popping off. And every time I go to that dentist, he says, oh, well, your bite is not set up for this. I'll put it back on, but it's really not going to last. And then the one time they break, he goes, well, I'll replace it for you, but it's really not going to last. And the patient keeps telling him, I really want to fix this so it doesn't happen. But the dentist, for either one of 2 reasons, either he didn't want to hear it, and more likely, he didn't understand how to fix the problem, right? So he kept coming up with excuses. And I told him, I'm going to give you the solution to your problem. It's very different than what your last dentist did. Let me show you something that looks quite similar to your case. And then if it's okay with you, I'll show you the process of which we can accomplish this for you. So if he agrees, we go through the whole treatment, we seat the case. I did a whole arch of dentistry. I had to open his bite. He was over collapsed. There was no room. Everything that you would learn going through a spear hoist continuum. He comes back to get his teeth cleaned 6 months later. And he goes, doctor, I got to tell you something. He says, I've been dealing with this problem for 20 years, driving me crazy. I had to be careful what I chewed. I never got a result. He goes, this is the first time in my life in 20 years. I am so confident I can bite into a steak, bite into a piece of pizza.